Well, now that your kids are getting back into sports for the fall, it's really important that you know which injuries could be season-ending.
Oh, man, and that's especially true for the knees. So here to talk about what you can do for any young athlete suffering from knee injuries is Dr. Matt Daggett, orthopedic specialist from Kansas City University. Thanks so much, Dr. Daggett.
Yeah,
So we're going to start with ACL tears.
Yeah.
You know, we're sports fans. You always hear about it. But for people who don't know, why is it such a devastating injury?
Yeah, so ACL injuries, we really focus on the ACL, but it's really an injury to the entire knee. Oftentimes, you'll injure the meniscus or the cartilage or supporting structures in an ACL injury. And that has lifelong consequences to that. So sometimes it's not just the immediate rehab and length of recovery that's impactful, but just the lifelong consequences to the person.
Sure. So when something happens, we often hear about repair or reconstruction. What is the difference between the two, and how do you know which way you should go?
Yeah, repair and reconstruction, that's a great question because oftentimes they get interused. And repair is where we preserve the normal ACL. So yes, it's injured, but we're able to maintain it and basically suture it and bring it back to where it belongs. Reconstruction is where we're using a part of the body or donated tissue to become the new ACL.
Okay, so starting from scratch.
Yeah, and for really the last 30 years, up until 5 years ago, reconstruction was definitely the way to go. It was really arguments at sports medicine conferences about which technique to do, but now we're realizing that maybe the patient's own anatomy has a great role in returning them to function.
Sure.
Interesting. And I was kind of surprised to see this, Doc. Girls soccer, a lot of injuries there. What's going on?
Yeah, unfortunately, especially young female athletes are at risk for re-injury. And as orthopedic surgeons, we like to think our results are fantastic. But reality is sometimes patients do suffer re-injury, 10 to 20% of the time. And unfortunately, in female soccer, there was a recent publication demonstrating that 40% re-injury rate in some subset populations. So really pretty high-risk population, and that's where we really got to focus our research and initiatives on finding better techniques to get these patients back to health.
Sure, so you hurt yourself once, you're more likely to do it again. What about those young girls or younger athletes who then become adults and they still want to be active, they're still riding bikes, they're still running? How can they make sure that they're doing it safely?
Yeah, so one, maintaining movement and staying healthy is definitely the key. We don't want to get stationary and we don't want to let a previous injury impact our future health. So identifying and make sure you get the right knee stability and the right, whether that's physical therapy or surgery, and then also just making sure you're doing the right movements, whether that's HIIT training and doing modifications to that or just normal day-to-day out. I'm a big believer that we don't really know our expiration date in this world. We might as well do what we enjoy, and making sure we stay moving is a part of life.
Yeah, and you know, it's like you always hear about football when it comes to concussions, but I know soccer. You know, a lot of concussions there. Even like women's basketball, I was reading about some scholarship athlete. She just bad luck. She kept colliding with people, and you know, so really any sport, you know, you could be concussed. Yeah,
for sure. Especially obviously collision sports are at a higher risk of concussions, but it can certainly happen in any sport, and especially soccer. We're seeing more and more of that.
Yeah. And one of the real quick questions, when you mentioned the people who have a tendency to get re-injured, I don't know if you're a Royals fan at all. Adalberto Mondesi. You know, are some people just unlucky?
Yeah, some people definitely are unlucky. I think we're also understanding in ACL re-injuries, for example, we've done some research at Kansas City University on the anatomy and biomechanics, and in combination with Santi, which is our international sports medicine collaboration. ACL injuries, for example, the re-injury rate is because we're not appreciating all of the structures that are damaged. There's a lot of supporting structures that contribute to stability, and that really impacts our clinical outcomes. And so our recent publication demonstrated a fourth of the re-injury rate in ACL with reconstruction, where we are addressing these injuries, versus ACL traditional techniques alone. So yeah, you can just have bad luck, but it's also, we got to appreciate all the injuries that occur as physicians and make sure we're treating the whole person and the whole injury, not just the specific ACL.
Gotcha. Yeah, good stuff.
Well, Dr. Matt Daggett.
Good stuff.
Yeah, thanks.
Thank you for coming in.